I am Morgan Packard Lorio, MD. I'm an orthopedic spine and hand surgeon with advanced orthopedics. I've been practicing approximately 25 years. I always wanted to be a reconstructive surgeon. I appreciate the intensity of neurosurgery, the elegance of plastic surgery. My combined orthopedic spine and hand fellowships allow me to marry these two disciplines. I focus on spine and peripheral nerve surgery. I enjoy taking someone that is broken and making them whole again. My personal injury drove me to become a spinal expert so that I could help myself and others. On July 12, 1982 at 10 a.m., I fell 35 feet, hitting cement and steel while working on scaffolding. My injuries were multiple and included spinal ones. A lot of what I do and a lot of what I know is not based on what I learned in books or actually during my fellowship. It's actually what I've learned walking this path of having a spinal injury. So I can speak to patients in the terms that they use. I understand things the way they describe them to me. Some of the things that frankly get blown off by some surgeons, I key in on because I understand where they're coming from. My childhood influences were my mom and dad. My mom and dad raised me to define myself by my work, my word, and my work ethic. Therefore, I bring my all to bear in the surgical management of my patients. I grew up in the heart of Cajun country in Louisiana. My simple, humble beginnings have not been forgotten. I use them as guideposts, and I always strive to give back. In addition to being a spine surgeon, I do a tremendous amount of work advocating for my patients, not just at a local level, but at a national and international level. It's for my patients and for other surgeons' patients. And the reason I do it is not just selfish for myself, because obviously that's the first thing that comes to mind, I'm sure, but I have a wife that I love, I have 4 kids that I've adopted, and I want them to have access to care, and I want my children's children to have access to care. There are 3 reasons why I think a patient should choose me as a surgeon. Number 1, if you desire a thorough exam correlated with your MRI. Number 2, a candid professional assessment that you can understand. And number 3, a surgery, if indicated, specifically tailored to you and your needs. Then I'm your guy.